I am Dr. Munazza Aziz. Have you recently noticed any kind of change in the breast tissue or in the armpits? If yes, the team of breast cancer surgeons are here to help you.
What are the steps to take if you notice a lump in your breast, and when should you be concerned?
Any kind of change in the breast on self-examination can be a warning sign of breast cancer. The change can be as subtle as any changes on the skin or the skin of the breast or in the armpits. It can be in the form of any lump, any discoloration of the skin, any change in the shape of the nipple, or any kind of symptoms that develop in the armpit. They can be a warning sign for breast cancer.
Beyond lumps, what are some early warning signs or symptoms of breast cancer to be aware of?
Any kind of discharge from the nipple, which can be any kind of blood stain discharge or fluid discharge from the nipple in the absence of breastfeeding, can be a sign. Other than that, any kind of infection of the breast tissue can be a sign of underlying breast cancer.
What are the different types of diagnostic tests for breast cancer, and how does one prepare for them?
So if anyone notices a change in the breast, in any of the breast tissue or in the armpits, then they should go to a surgeon and get examined by a doctor. After the initial examination, detailed examination, the necessary tests that are needed are usually a mammography if the patient is above 40 years of age, or an ultrasound of the breast if the patient is less than 40 years of age. According to the reports of the mammography or ultrasound, a biopsy may be needed for the initial diagnostic purposes.
If a mammogram or ultrasound comes back abnormal, what additional tests might be needed, and what do they involve?
In the presence of any lump in the breast tissue that is identified to be dangerous or malignant on the mammography, a biopsy is usually needed. A core cut biopsy is taken from the lump, and that is examined for the presence of cancer. Other than that, some investigations such as CT scan of the chest and abdomen may be needed to identify the stage of the disease.
How are diagnosis results for breast cancer explained, and what information is most important to understand?
So after the examination, the initial radiological investigations like mammography or ultrasound and the biopsy results, the preliminary diagnosis is made, and that is explained to the patient that there is a risk of cancer or the cancer has been identified. After the initial diagnosis, the patient is advised some investigations to stage the cancer. After the staging investigations, the patient is given a diagnosis and a management plan after discussion with the multidisciplinary tumor board.
If a diagnosis of breast cancer is positive, what does the stage and type mean for prognosis and treatment options?
So the treatment of breast cancer, that depends on the stage of the disease. The treatment modalities that are given are usually in the form of chemotherapy, radiation therapy, and surgery. But the sequence of these treatment plans is made according to the stage of the disease. For stage 1 and 2 cancers, we usually proceed with the surgery first, and then the chemotherapy and radiation therapy is given. For stage 3 disease, usually the chemotherapy is given before the surgery is done to downstage the tumor and to reduce the size of the tumor so that the surgery can be done completely. After the surgery, there is a mode of treatment that is called the adjuvant therapy that is given to selected patients.
What kind of treatment options are available for different types of breast cancer diagnoses, and what factors influence a doctor's recommendations?
According to the stage of the disease, the age of the patient, the type of the cancer that is diagnosed on the biopsy, the patient is given a plan for treatment, which usually includes the chemotherapy and the surgery. According to the surgical options, we have two main options, that is either the removal of all of the breast tissue, which is called the mastectomy, or removal of that area which has got the cancer, which is usually in the form of breast conservation surgery. The treatment plan and the decision is made in collaboration with the patient, the oncologist, and the radiologist and pathologist according to the stage and the severity of the disease and the risk of recurrence of the disease.
How can patients be involved in the treatment decision-making process and ensure they understand the benefits and risks of each option?
The type of surgeries, which include the mastectomy and the breast conservation surgery, they both have their own pros and cons and their risks. The risks are explained to the patients, usually in the presence of the attendants, and then the patient is given the option to decide between the options and to embark on the treatment journey with the doctor and the oncologist.
What support systems and resources are available for coping emotionally and psychologically with a breast cancer diagnosis?
For any female who is diagnosed with the breast cancer, the treatment plan is usually very severe and intense, and it is a very huge emotional setback to the patient to go through all of that. To address these problems, we have a psychologist and a psychiatrist on board who discuss the treatment plan in detail with us, with the patient, and they help the patient throughout the treatment journey. Other than the psychological support given by the physicians, we also have a support group for these patients. The support group basically consists of the consultants, the doctors, along with the patients, the breast cancer survivors, as well as the patients who are going through the treatment journey, so that they can discuss and elaborate their problems and find a solution to it in help with the other patients.
Are there any lifestyle changes or adjustments one can make to support their well-being during and after breast cancer treatment?
After the treatment of the breast cancer, the patients usually go through a lot of emotional and psychological trauma. To cope up with that, we advise the patients to adapt a healthier lifestyle that includes the regular physical activity as well as a healthier diet, along with some kind of physiotherapy for the arm after the surgery. The patient is advised about the surveillance program, and the patient needs to come up for the follow-up, as there is always a risk of having the cancer back or to have the cancer in the other breast as well. The screening program is the surveillance program is usually offered to the patient for a period of 5 years, and the patient needs to come for repeated visits and some kind of investigations for a follow-up period of 5 to 10 years.